Thank you very much, Mr. Chairman. The title of my presentation is as shown. I would depart a bit from the norm by not speaking so much about GALVmed. We have quite a number of brochures in the room behind through which you can know more about us. But very briefly, and as my CEO mentioned earlier, we are an animal health product development, adoption and partnership organization, a not-for-profit organization with pro-poor focus. We are funded predominantly by the UK Department for International Development, the Bill and Melinda Gates Foundation, and we've received funding from the EU in the past. What we do is to promote the development and adoption of animal health solutions, including vaccinations, therapeutics, and diagnostics for the benefit of resource-limited livestock producers in developing countries. And we do this by working with partners. We work, even though we have offices only in the UK, in India and Nairobi, Kenya, we work with partners all over the world. I want to position my presentation strictly in an arena of justifying the role and responsibilities of veterinary paraprofessionals. And I will do that by, first of all, very briefly telling us what we already know in terms of livestock demographics, human population growth, demand for animal protein in different parts of the world, which has occasioned increase in the number of people requiring livestock products. But also we know in the world, the demographics of livestock distribution has not changed very much, but there is a growing tendency for people to become more and more linked with their livestock. And this has become an issue of public health importance in terms of the spread of zoonotic diseases. Since the 1940s, of the nearly 335 zoonotic infectious diseases, nearly 250 of these are linked to animals. And the livestock producers faces the brunt of these devastating diseases. So this kind of scenario calls for a concerted effort by all the stakeholders in the livestock sector to work together to identify solutions. I have asked the question why animal health has lagged behind human health. There are various schools of thoughts, but following the introduction of structural adjustment programs in many countries, the human health sector advanced very ethical arguments for the introduction of what is called primary health services. And this led to the evolution and development of what was then called community health workers. In the livestock sector, that also experienced the same problem, the development of the sector was largely left in the hands of the private sector, even though we know that there are also diseases of public health importance. Consequently, the evolution of community animal health workers was left predominantly to non-governmental organizations responding to need, as it were, like fire brigades, during situations of famine in different countries, situations of war, during which conventional health practice has broken down. And we know all these are happening against the backdrop of poor infrastructure and disease outbreaks. In terms of the numbers of available personnel, this chart is from documentations from OIE, and it shows very clearly that the proportion of veterinarians and veterinary paraprofessionals working in the animal health sector could be as high as 85 to 90% in the Oceania and Europe, whereas in Africa and Asia, it's roughly 20 to 25%. Other statistics from OIE showed that the number of veterinarians available to 10,000 livestock units averages about 5 in African countries, whereas the number of paravet professionals to 1,000 livestock units was about 1 paravet to 2,000 animals.